Hello, Mr. McGee. My name is Carmela. I'm going to be your nurse today. I have my equipment, my stethoscope, my pen light, my watch with a second hand, and a hand sanitizer. So first I'm going to wash my hands. And I'm going to be talking my way through this so that the person on the video understands what I'm doing in case they can't see. So earlier this week we talked about consent, right? And you signed a consent and we scanned it, giving permission to video so they can assess my head-to-toe assessment.
Yes, ma'am.
Correct? So you did consent.
Yes, ma'am.
Okay. So first I'm going to check your ID band for your name and your birthday. Okay, good. Next I'm going to make sure you're comfortable, and later I'm going to have you lay down and put this out because you're a tall guy. So for now I'm going to stay here for safety purposes, be right in front of you. Are you comfortable?
Yep.
Okay. All right, so I'm going to explain the procedure next. We're going to be doing a head-to-toe assessment, which means I'm going to be touching your body, listening with the stethoscope. At any time you feel uncomfortable or you feel pain, you'll let me know.
Yes.
Yep. Okay. All right, so first I'm going to approach you and look at your eyes and ears for symmetry. You know, let me back up. Let me start. I'll do that later. Let me go with your orientation. So, what is your name?
Ansel McGee,
And where are you?
school district office,
Okay, and what day of the week is it?
Wednesday.
Okay, and situational, what are we about to do?
Head-to-toe assessment.
Okay, good. So I would document that as alert and oriented times 4, person, place, time, and situation. Okay, so now that I got your ID, I know who you are, we got consent, you're comfortable, you're safe, you're alert oriented, now I'm going to move into your physical body. I'm going to look at your eyes and ears for symmetry, and they are symmetrical, so I would document that as your eyes and ears are symmetrical. I'm going to look in your ears. Okay, no discharge noted, no drainage. Okay, next I'm going to turn off the light so I can look in your eyes to do your pupils. Okay, so stay safe. All right, so I'm going to have you look right here at my nose. I'm going to shine a light in your eye. Good. I'm looking at your pupils' reaction to light and the shape of your pupils. Good. I'm going to turn the light back on for this next part. Okay, I'm going to have you look at this pin light right here and follow it as it moves away. Good. And back to you. Excellent. I was checking your eyes for accommodation. So I would document that as PERRLA positive, which means that your pupils are equally round and reactive to light, and accommodation is present. Okay, so now I'm going to look at your head. Is there any pain or discomfort anywhere? Okay. All right, checking your skin on your arms. No abrasions, no bruises noted. Your skin is warm and dry. Next, I'm going to check your radial pulses. They are equal. They are +2. They're equal in rhythm and rate, and they're strong. Okay, can you squeeze my hands? Good. So I would document that as a bilateral equal hand grasp. Also, your pulse, I would document that as +2 with a regular rate and rhythm, strong pulse. Your skin is warm and dry, I would also do that. Okay, so now I'm going to look at your lips and your mouth. So go ahead and open your mouth for me. Okay, good. So your tongue is moist and pink. You can go ahead and close your mouth. Your lips are red and moist as well. No, it doesn't look like any dehydration. I did see a few cracks and decay in your teeth. Do you have any pain in your teeth?
No.
Okay, and your gums are not irritated. So I would document that as your lips and tongue are pink and moist. Let me check your turgor here as well. As I go over your chest, your skin is warm. Okay, now I'm going to go ahead and listen to your lung sounds. Just breathe normal for this first part, okay? I'm going to listen to 6 areas on the front and then 6 areas on your back. Okay, just breathe normal. Good. Okay, breathe in deep. And out. Good. And again, breathe in deep. Good. All right. I'm gonna listen on your back. Breathe in and out. Good. Again, breathe in. Again. Good. Again. I'll just take a minute and relax. I don't want you to hyperventilate. Okay, go ahead and breathe in deep and out. Good. Again, breathe in deep and out. Okay, good. Your lungs sound great. So I would document that as that your lungs are clear in bilateral in all lung fields. Your lungs are clear. Okay. So back to your arms. Let's go ahead and do some active range of motion. Active means you are going to do it. So bend your elbows for me. Good. Lift your arms above your head. Good. And do your wrist. Excellent. So I would document that as your upper extremities are positive for range of motion. Okay. Next, I'm going to check your apical pulse. In order to do this, that's the apex of your heart. I need to go down to the 5th and 6th rib. Right between your 5th and 6th rib is your 5th intercostal space. Mid-clavicular line, I'm going to go down until that meets up. And that is the apex of your heart. That's where I'm going to listen for 1 full minute to your pulse. So let me go ahead and listen there. Okay. Okay, excellent. So after 1 full minute, you have 78 beats per minute. S1, S2, I would document this as S1, S2 heard, no gallops, no murmurs noted, regular rate and rhythm with a pulse, apical pulse of 78. Okay, I'm going to go ahead and let me do some sensation on your hands as well. I'm going to do cap refill first. Good. Okay, so with your cap refill, I would document that as brisk and less than 3 seconds bilateral in both hands. This next part, I'm going to have you close your eyes and I'm going to test sensation in your hands. So when I touch you in your hand, you tell me where you feel me touching you, okay? Go ahead and close your eyes. I'm going to stand here so you don't fall off the bed. Where am I touching you?
On my left index finger.
Left index. Good.
Left pinky finger.
Good.
Left top of hand.
Good.
Right thumb. Right ring finger.
Are you sure that's your ring finger?
That's my middle finger.
Correct. Your right middle finger.
Right middle finger.
And last.
Right pinky.
Okay. So I would, you can go ahead and open your eyes. I would document that as that you have positive sensation in your upper extremities. I already did your hand grasp. Those were equal and strong. So I think we've got the top covered. So let's go ahead and have you lay down on your back and be in a comfortable position. You'll be laying here for a few minutes. Okay, I'm gonna pull this out to give you extra room since you're so tall. All right. All right, I'm gonna provide you with a blanket. We're using a towel today since we don't have a blanket. This is for your privacy and comfort. Are you comfortable?
Yeah.
Okay. So first I'm gonna start with your abdomen. With your abdomen, the first thing I'm gonna do is inspect. I'm just gonna look at your skin. I don't see any scars. I don't see any bruising. Next, I'm going to listen to your vowel sounds. I'm going to auscultate your vowel sounds. So just relax and be normal. Good. 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 Okay. So I would document that as positive vowel sounds in all four quadrants because I did hear your vowels. Next, I'm going to do palpation. So I'm going to palpate your abdomen. You tell me if you're tender or sore in any of these areas. Okay, down by your bladder. Okay, so I document that as your skin is warm and dry, your abdomen is slightly distended with positive vowel sounds in all four quadrants with no pain noted. All right, so next I'm going to move down to your legs. So when we do your legs, I'm going to have you do one at a time, okay? So first I'm going to look at your legs. I'm going to look at your skin. No bruising, no abrasions. I'm going to look underneath. No sores, okay? Same thing over here. Okay, skin looks good. Your skin is warm and dry on both legs. Okay, so next I'm going to have you just do, well, before I do range of motion, let's go ahead and check for edema. So there's no edema noted. Bilateral, so I would document that as no edema noted bilateral. Next, I'm going to check your pedal pulses. And I'm going to do one at a time. Actually, I'm going to do them both at the same time, but let me find one at a time. Oh, good. Excellent. So you have positive pedal pulses, strong, bilateral, equal rate and rhythm. Now I'm going to try and find your posterior tibial pedal pulses. A little bit harder to find. Oh, there they are. And they are palpable. So I would document that as your pulses, bilateral pedal pulses are palpable and equal. Okay, I'm going to go ahead and do, have you do range of motion. So active range of motion again is where you're going to do 3 different exercises for me, okay? So first, one leg at a time, bend your knee up. And your other one. Okay, now we're going to check your hip. Lift your leg up. Good. And your other one. Excellent. Now let's do your ankle. Flex your ankle, move your feet. Okay, and flex your ankle. Good. So I would document that as positive active range of motion in your lower extremities. Next, I'm going to have you push against my hands with your feet. Good. Now pull. Good. That's equal bilateral, so I would also document that as positive for pedal push-pull, equal bilateral in both lower extremities. So let's do your calf refill. Excellent. Okay, your calf refill is brisk, less than 3 seconds in both feet, bilateral. I would document that as brisk, less than 3 seconds, calf refill, and positive in both legs. Okay, so we did your range of motion, did your skin. I'm just kind of talking out loud as we go through. Okay, you can go ahead and set up for me carefully. This last part, I'm going to go ahead and do a sensation, just like we did on your hands, but it's going to be for your feet. So I'm going to have you close your eyes, and I'm going to touch you on your foot, and you tell me where I'm touching you, okay?
Mm-hmm.
Where am I touching you?
Left big toe.
Okay.
Left pinky toe. Left top of foot.
Good. You can
Right.
You can say what.
Right middle toe.
So you can say like it's your first, second, third, or fourth if you want to do it that way. Which toe is this?
Third toe.
Okay, and this?
Right pinky toe.
All right. So I would document that you have sensation in your lower extremities, bilateral. I would make a note though and have the doctor further assess you because in your right foot, you missed all 3 of them. You did feel that I was touching you, but not in the right position. So he'll probably just have me reassess you, or he may look into that. But I would document that the interpretation was incorrect, but you did feel sensation bilateral in your lower extremities. Okay, so that is going to conclude that part of it. So the next part is our patient education. So is there anything that you would like to talk about or ask questions about concerning your health while I'm here?
Yeah, when I lay down and go to sleep at night, I get heartburn pretty bad.
You get heartburn?
Yeah.
And what time are you eating dinner?
Around 8 o'clock.
Okay. And what time are you laying down?
About 8:45, 9.
Okay. All right. So I have some patient education here for you. I just pulled out of my file, and it is about GERD, which you call acid reflux. We also call it GERD. We'll make an appointment with you on our way out so you can have some further assessment, talk to your doctor about this as well, an appointment just for that. I'm going to go over some things with you, and then I'm going to have you answer some questions back to me, make sure you understand, okay?
Okay.
So according to our patient education for GERD, you must maintain a healthy weight, so you can discuss that with your doctor. You want to avoid laying down within 2 hours after eating. You want to avoid eating late at night. If you do lay down, you want to elevate your bed 6 inches, so put some extra pillows underneath you. You want to avoid foods that irritate your stomach, such as alcohol, fat, chocolate, or caffeine. Okay? Also, it says here that you need to make a follow-up appointment with your primary care physician to discuss further medications or testing he may want to do. Now, the following are: call your doctor immediately if you have any of these symptoms before you see him. Okay? So, if with the concerning the acid reflux, if you're having trouble swallowing, if you're having pain when swallowing, if you're feeling like your food is caught in your throat, if you feel that you have heartburn so bad that you vomit and throw up, you want to call your doctor right away. Okay? All right, and I'm going to give you this information sheet to go home with. So just to reiterate what we just talked about, what are some things you can do until you see your provider?
Make sure I wait 2 hours after eating to go to bed.
Mm-hmm. Good.
If I do go to bed, elevate with some pillows, 6
Good.
inches.
Great. Now, can you name a food or two that you should avoid?
Alcohol, chocolate,
Excellent.
fat.
Excellent. And you're going to keep your appointment with your doctor. Okay. So I'm going to give this to you to go home with, just in case you forget what we went over. If you have any other questions, there's a little bit more detailed information.
Okay, thank you.
Okay. All right. You're welcome. Thank you for participating in this head-to-toe assessment.